So moving on to different types of drowning or the different patterns that we can see in drownings, and we have wet or typical drowning, which is also known as primary drowning, and we have atypical drowning. Wet drowning, the name gives everything. Wet simply means that while drowning, the person aspirated the fluid. So the fluid is found in the air canals, the fluid is found in the respiratory tract, in the lungs, in the pleural spaces, etc. In atypical drowning, there is sudden reflex laryngeal spasm of the whole respiratory tract. So there is no aspiration. And as we move on, we will see we will see more details in different slides, so it will become clear. So moving on to the next slide and see what we have there. The primary, typical, or wet drowning. Typical or wet drowning occurs when water is inhaled into the lungs, and this is also known as also known as primary drowning. And now in different settings of drowning, like the person can drown in fresh water. Fresh water means stream, fresh water means a river, anything which doesn't contain sodium chloride. And the person can also drown in salty water or the sea water. And these both different types of water settings can result in different pathophysiological phenomenon of the drowning or the different causes of drowning. Like for example, we take the example of fresh water. If a person drowned in fresh water and he aspirates the fluid, since we are talking about the wet drowning, so the person aspirates the fresh water and the fresh water enters his respiratory tract, like for example lungs. When the water reaches the lungs, it since the water is hypotonic, it is fresh, it does not contain much of salts, so it is hypotonic, and the cells in the lungs, the RBCs in the alveoli, etc., and sorry, in the alveolar capillaries, etc., RBCs there and the cells of the lungs are kind of hypertonic. So water will rush inside the RBCs, causing hemodilution. The water will enter the RBCs and cells of the lung parenchyma, and this entering of water will cause hemolysis of RBCs and also the rupture of cells of the lung parenchyma. Since the cells, what is the main constituent, what is the main electrolyte present inside the cells? Cells are bags of potassium. You can say the maximum concentration of any ion in any cell of the body is potassium. So once the cell gets ruptured due to entering of massive amounts of water, the cell gets ruptured and potassium gets released in the body fluids, and potassium is a cardiac toxin. This potassium will cause ventricular fibrillation, and this excessive ventricular fibrillation will result in the death of the person. So this is the pathophysiology when the person drowns in the fresh water. And there is a different pathophysiological pattern for the salty water. In salty water, we are talking about the wet drowning. So when a person aspirates salty water, water has high salt content. So it is hypertonic. This hypertonic fluid, when it reaches the lung parenchyma, when it reaches the alveolar spaces, this will suck the fluid out of the cells. So the cells will become wrinkled. The sucking of fluid from the cells of the lung parenchyma and the RBCs will cause edema of the lung. So there will be pulmonary edema, congestion type of presentation, and this congestion will lead to heart failure, and this heart failure will cause the death. So there are two pathophysiological patterns of death in the type of in the first type of drowning that we are discussing, i.e. the wet, the typical, or the primary drowning. And moving on to next slide, we will just have beautiful illustrations of what we have discussed in this slide. So first we are talking about the pathophysiological pattern of death in the fresh water. The fresh water contains little salt. It is hypotonic compared to the body fluids, compared to the body cells. So when it enters the airways, reaches the lungs, it gets absorbed into the blood and it dilutes the RBCs. Because it is hypotonic, so it will enter the high electrolyte RBCs, because this is the rule of the hypertonic, hypotonic, and isotonic solutions. The water always flows from low salt content to high salt content, from low salt environment to high salt environment. So the water will diffuse into the RBCs, and RBCs will get ruptured as seen here, and RBCs contain potassium. The potassium will get released, and we know high potassium is a cardiac toxin, cardiac toxicity, and this cardiac toxicity will result in ventricular fibrillation. So the actual cause of death in the primary or typical or wet drowning is ventricular fibrillation. So that's all about the drowning, the pattern of drowning in fresh water. And now we move on to the pattern of drowning in the salt water or the seawater. Seawater contains salt, so it is hypertonic. When it enters the airways, it reaches the lung parenchyma. And when it reaches the lung parenchyma, since it contains high salt content, so there will be the movement of fluid from the circulation into the lung parenchyma. The RBCs will kind of get wrinkled, the ABC will get crenated, the ABC will release the fluid because fluid likes to move from low salt environment to high salt environment. So RBCs will lose the water, and the water will move towards the places which contain this seawater. So this will cause pulmonary edema, and this pulmonary edema will lead to congestion of the whole cardiovascular system, the congestion of the pulmonary arteries, congestion of the heart. This will lead to congestive heart failure and eventual asystole. So this is the pattern of death. This is the pathophysiology which is seen in the deaths associated with drowning in the salt water. So the paradigm we previously established, we said that drowning can be, the paradigm we previously established, we said that the drowning can be divided into wet drowning and atypical or dry drowning. And wet drowning can be in fresh water, and wet drowning can also be in sea or salt water. And we have discussed this half of the classification of drowning, and now we are left with the atypical drowning. So in the next slide we are going to discuss that. What is atypical drowning? This is also known as dry drowning. And when does it occur? Water does not enter the lungs because there is sudden laryngeal spasm induced by small amounts of water entering the larynx, and it is quite uncommon. That's why it's called atypical. It's not typical, it's not the usual pattern seen, but this can occur. And in this case the death is extremely rapid because you are preventing the body from its main source. There is no oxygen, there is sudden laryngeal spasm. Obviously the death is going to be rapid. Now how does it happen? What reflexes cause this sudden laryngeal spasm? So in the next slide we are going to discuss that, the pathophysiology of the atypical drowning. There is sudden stimulation of trigeminal nerve receptors by immersion in the face, by immersion of the face in water, and this elicits reflex apnea, reflex stoppage of breathing, and bradycardia. There is also peripheral vasoconstriction. This is known as diving response. And the next thing is that atypical drowning is a very high association with anxiety and fear. So when there is contact of the body, a person who is afraid of water, it is quite typical in that. So when there is contact of the body with water of temperatures less than 20 degrees centigrade, i.e. cold water has also cold water also leaves the person prone or susceptible to atypical drowning. This leads to sudden cardiac arrest in certain cases following the entry of the water into the nose. So there is strong vagal response. Let's go to this slide once more. And so the first thing, the typical response is diving response. How does it happen? The trigeminal nerve receptors get activated when the face gets immersed in water, and this elicits reflex apnea, bradycardia, and peripheral vasoconstriction. This is known as diving response. But in some cases, there is strong vagal response, and this is augmented by anxiety and fear and contact of the body with temperatures, with waters of temperature less than 20 degrees centigrade. So this, so there is sudden cardiac arrests. So there are, I think we should recall a little bit that drowning we said was of two types, wet and atypical or dry. And wet we further discussed has two types, drowning in fresh water and drowning in salt water or seawater. And atypical has also two types. The diving response, which is caused by or which is elicited by trigeminal nerve, and there is strong vagal response in some cases, which is highly associated with anxiety and fear, and vagal response causes sudden cardiac arrest. So that's all about the different types of drownings. And now we will move on to Postmortem artifacts. What is the meaning of artifact? You will also study artifacts of autopsy. Artifacts simply means anything that is a lie or anything that is false, not true, anything which is misleading. Anything that hides the truth from you is called an artifact. So different patterns can be seen in the post-mortem findings of the bodies recovered from water, and this can cause a little bit confusion. So the bodies immersed in water may be subject to movement of water due to tides, waves. So the bodies can come in contact with rocks, salt, and underwater objects. All of these can cause injury to the skin and underlying structures. So specific patterns of injury can be seen, and artifactual post-mortem injuries produced in such circumstances must be differentiated from ante-mortem injuries. Ante-mortem means before the death. So you must be able to differentiate certain lesions, certain injuries. Sorry, you must be able to differentiate certain lesions, certain injuries that you will see on the body recovered from water. So you must be able to differentiate whether it was post-mortem, i.e. That it occurred after the death of the body, or it occurred ante-mortem, i.e. prior to the death of the body. So there are and this picture represent this round type of lesions, and this is quite characteristic of injury of the dead body by crustaceans such as crabs and other marine life like sharks, alligators, fish, insects, etc. can also cause lesions on the body. But another thing to bear in mind is that as the post-mortem interval increases, the fragments or even whole limbs may become detached and lost due to decomposition and movement of water. But and this is a lower topic. It's not mentioned in most of the books. I thought that might help you a little bit with the concept of post-mortem and ante-mortem wounds. That's why I bothered to mention it here. So that's all about the post-mortem artifacts. And now we move on to the different investigations, different tests that we can perform to confirm that the person actually drowned and the person was not thrown into water after killing him through some other mechanisms. So the first test is strontium concentration test. The first test is strontium concentration test, and the concentration of strontium in tooth sample or the teeth sample has been useful in diagnosis of seawater drowning. So it can help you determine or establish the cause as drowning in the seawater, as strontium is quite common in the different settings of seawater. Similarly, LB ratio. What is LB ratio? It is lung body weight ratio. So obviously the lung gets expanded. There is emphysema aquosum, so the lung is waterlogged, it is heavy. So obviously this ratio will increase. The ratio of the lung weight to the body weight will increase. This can give you a certain hint about the cause of death, and it can help you establish the cause of death as drowning. Similarly, another test is post-mortem vitreous humor sodium chloride. Obviously, if the person has drowned in seawater, there is sodium chloride, so the content of sodium chloride will increase in the vitreous humor. But these tests are not that important. The tests that are really important and that I have mentioned in quite a big size here, you see, the diatoms and the Gettler test. These two are quite important tests. What are diatoms? I have previously mentioned it. Diatoms are microscopic organisms present in sea and fresh water, and the presence of diatoms in the lung tissues, in the internal organs, and the bone marrow is considered by some to be the most perfect evidence in the diagnosis of death by drowning. But it must be emphasized, however, that the interpretation of diatom testing remains still a little bit controversial, as diatoms have been found in different types of food. So the presence is confirmatory, but it's still a little bit controversial. It's still considered a little bit controversial by some forensic pathologists, because different types of foods have been identified who contain diatoms. And the last thing is Gettler test. What is a Gettler test? Gettler test is simply sodium chloride concentration, but which sodium chloride concentration? You check the sodium chloride concentration in the left ventricle. You take the fluid from the left ventricle of the body recovered from water, and take the test this fluid, um, and determine the concentration of sodium chloride in the fluid of left ventricle of the body. This helps to establish the cause of death as drowning. So that's all about the different types of drowning and the pathophysiological patterns. And now we move on to the MCQs. And there are quite a bit MCQs from this topic in the KMU past papers. Here are some of these. The body is on the autopsy table. The first one is, the body is on the autopsy table and there is leathery, fine, tenacious and persistent froth at mouth and nostrils. Then that is due to drowning. This is the correct answer. I did not bother mention the other choices here. Gettler's test is performed to diagnose drowning, and what do we do in Gettler test? We take the fluid from the left ventricle of the dead body. And what's diatom test? It is a test that is performed to diagnose drowning. Another, the last MCQ, I mentioned all the choices because it's quite a conceptual MCQ. A diagnostic feature of death due to drowning is wet body, wet clothes, washerwoman in hands, petechial hemorrhages, or copious amounts of froth at the angle of nose and mouth. Can you choose for me the correct one? Yes, it's E. Why? Because if the body is thrown after being killed through some other mechanism, if the body is thrown in the water or in a river or in a killer, obviously the body will be wet. If the body is thrown after killing, obviously the clothes of the body will be wet. The person is thrown into the water after being killed, there will be a wrinkling of the skin of the hand, so there the washerwoman hand finding will also be positive. Petechial hemorrhages is not a sign of drowning. So the most confirmatory test or the most confirmatory sign in this MCQ is the presence of froth, and it never hurts to recall that what makes this froth? Yes, the aspirated fluid reaches the lung and gets mixed with the bronchial secretions and the pulmonary cell surfactant, and this creates froth. So that's all about the drowning. I hope you learned from it.